Our friend Sally has Addison's disease, which is where your body produces insufficient cortisol levels. Sally recently got over pneumonia, but still isn't feeling well.
She is feeling tired, has a headache, low blood pressure, tachycardia, tachypnea, fever, nausea and vomiting, and a rash.
Sally's husband calls 911 and she is going to the emergency room.
The doctor orders for her blood to be drawn because based on Sally's medical history, he suspects adrenal crisis. The blood test looks at cortisol levels, blood glucose levels, and serum sodium and potassium levels.
The cortex produces 3 types of hormones, all of which are called corticosteroids. Cortisol is a glucocorticoid that maintains regulation, suppresses the immune response, and is released as part of the body's response to stress. Cortisol production is regulated by a small gland just below the brain called the pituitary gland. Adrenal production is regulated by nerves coming from the brain and the spinal cord, and by circulating hormones.
Acute adrenal crisis is a medical emergency caused by a lack of cortisol. The pituitary gland releases adrenocorticotropic hormone, ACTH, causing the adrenal gland to release cortisol. Adrenal crisis occurs in 3 situations. 1. The adrenal gland is damaged due to Addison's disease, other adrenal gland disease, or surgery. 2. The pituitary gland is injured and cannot release ACTH. And 3. Adrenal insufficiency is not properly treated.
Sally was given a hydrocortisone injection and will receive supportive care, including IV fluids to maintain fluid balance.
Medication to manage her chronic disease can be expensive since it is a lifelong hormone replacement. She needs a better plan of care for monitoring her hormone levels and preventing recurrent hospital visits and increased medical costs.
Some risk factors to watch out for in the future include dehydration, infection, physical stress, injury to adrenal or pituitary glands, surgery, trauma, and abruptly stopping hormone medications. The nurse and Sally will work together to make a plan for managing outside stressors and set up her follow-up appointment with the primary care physician to continue to monitor her medication levels.